Welcome to this broadcast from the Marxist Workers Party, where we are again following the struggle of South Africa's community health workers. Today we are joined by Vuyo Siralarala, the West Rand Chairperson of the National Union of Public Sector and Allied Workers. Vuyo, welcome and thank you for agreeing to this interview. 6 weeks ago, the MWP interviewed Solly Malema, NUPSAW's national organiser. We'll share a link to that interview so our listeners can refresh their memories on that. But in summary, Solly explained to us that the community health workers were playing an essential role screening for COVID-19 in communities, in other words, checking people for symptoms, and also in contact tracing, finding those who have come in contact with someone who has tested positive. This required the workers to go door to door in communities, putting themselves directly in harm's way in order to fight the pandemic. We were told that CHW workers had deep concerns about their safety, inadequate training, a lack of personal protective equipment, PPE, and a lack of standardised procedures across the provinces in the various health departments. Now, in the 6 weeks since we interviewed Solly, the pandemic has exploded, especially in Gauteng, where you are based, Vuyo. Before we come to the role that NUPSAW is playing as a union, can you describe for us the situation facing CHWs on the ground? What are you hearing from those frontline workers? Were the issues around training and PPE resolved by the government? And what are the CHW's main concerns and even fears now that we are in the peak period of the virus?
Thank you, Comrade Sean. This is Vuyo Siralarala from West Rand, the Chairperson of NUPSAW. Apparently, up to so far in Gauteng, at first when the pandemic approached, we're having problems concerning the PPE, which later the Department of Health complied. Yet in other provinces, they are still having a difficulty into complying and adhering to towards the protection that has to be used by the CHWs. However, the CHWs are worried and they are having a fear of contracting COVID-19 because they are earning a little money. And as we speak, they signed a new contract that commenced on the 1st of July for permanent on level 2. We are still waiting. We don't know whether they're going to backdate or they're going to do what, because of they haven't done anything like induction to put us through on what we have to expect, what we have to do.
Well, Vuyo, it's excellent news that there's an agreement for the CHWs to become permanent workers. It's clearly a step in the right direction, even if the starting salary is level 2 rather than level 5. Can you give us some background of how this agreement was reached? And also, which CHWs does it cover? Is it only those in Gauteng at this stage?
Up to so far, that agreement of level 2 is for now, it's only covering Gauteng, as it was announced via the television by Bandile Masuku, the MEC of Health in Gauteng. For the other provinces, we are still doing the campaigns. The background about NUPSAW and the community health workers. We joined NUPSAW after a lot of struggling, ups and downs, fighting with the Department of Health with no help. We approached so many different unions, which happened to be the sweetheart unions to the Department of Health, where eventually in 2016, the community health workers joined NUPSAW. By that time, we were under the service provider that was giving us a lot of problems when coming to payments. Then in 2018, later on, the service provider's contract expired. And by that time, it was hard for the CHWs because during the year of 2016, most of the Commonwealth workers refused to sign with the service provider, where now they happen to lose jobs. Yet half of them went back to work via NUPSO's negotiations in 2018, and the majority is left outside since the struggle of 2016. Up to so far, for this level to be tabulated, it was an offer from the Department of Health because it complained that it has no money. That is the only level that it can offer. Yet we, as NUPSO, we are still looking forward to pursue our struggle forward to get what we deserve, because we feel that this level 2 is too little for what we are doing. And then go to other provinces. That is why we are planning a national strike, because we want other provinces to be catered for in that level to salary.
So the struggle for permanent jobs continues, as well as the struggle for a level 5 salary, what workers would consider a living wage. We know that NUPSO was planning an ongoing programme of action in support of these demands, and you mentioned a national strike just now. How have NUPSO's plans evolved in recent weeks? What is on the table for the way forward for the CHW struggle?
To answer that one, NUPSO was struggling at tabulating for the CHW to get a level 5. But unfortunately, the Department of Health decided to respond to say they're going to give the Commonwealth workers a level 2, which is 8,455 per month. And that permanent contract was signed on the 10th of July 2020, yet it commenced on the 1st of July 2020. About the national strike, we decided to low a low profile, as where we had to check the readiness of other provinces, because of it has to be a national strike. Then we are planning to have a meeting on Friday this week, so that we check the availability. We are sure so that at the end of the day, the employer shouldn't say, you are the minority that is working, drop off all your demands and return to work, so that we can go back to nothing. NUPSO is willing to take the struggle forward for the Commonwealth workers. And we were also demanding the 2,000 rands for COVID-19 danger allowance before that level 2 was offered by the Department of Health. Then we will hear from other provinces what are they actually planning. Shortly after this week, we'll be hearing where we stand.
Vuyo, in the Marxist Workers Party, we've raised the idea of SAFDO reconvening the Working Class Summit that they hosted in 2018 in order to rearm the working class for the new period of pandemics, lockdowns and deep economic crisis. In particular, we think the delays in implementing both SAFDO's own resolution in favour of establishing a socialist mass workers' party and a similar resolution passed by the 2018 Working Class Summit is forcing the working class to fight with one hand tied behind its back. We are fighting the bosses in the workplace, but we are not generalising the class struggle and contesting them on the political terrain. In that sense, we are giving the capitalist class a clear run. The result is anti-worker decisions like the reneging of the public sector wage agreement. What is your view on what SAFDO's role should be in helping to create a workers' party?
Except for the unions, the workers have no voice, where I think that SAFDO for convening that summit, it would help a lot, even if it can be done again sometime around this year when this lockdown has been uplifted, whereby now it would materialize because most of the workers would be involved.
And finally, Vuyo, the last thing for me to do in this interview is to welcome you as an individual into the Marxist Workers Party as our newest member. What informed your decision to join us?
I'm so humbled. I'm so humbled for being welcomed, and the reason for me to join that Marxist Party is just because I am a worker, and now it has a freedom of speech on behalf of the workers. Thank you so much.
Thank you, Vuyo. Well, that concludes our interview. The Marxist Workers Party will continue covering the struggle of the community health workers in future material. And we should mention as well that the struggle of the EPWP workers continues, and we will be producing material on the latest developments with that campaign soon. In closing, we are living in a changed world. The capitalist profit system has shown itself as completely unable to protect communities and lives in the face of this pandemic. The South African Medical Research Council estimates that the real number of deaths is 60% higher than has officially been reported. As many as 17,000 may have died already. It's thought that 3 million jobs have been lost since the lockdown began, plunging millions of families into complete poverty. Capitalism, the bosses, their politicians have no way out. It falls to the working class to organise mass struggle in order to lead society out of capitalism's dead end and build socialism. Only the ideas of genuine Marxism can arm the working class for that struggle. In closing, we appeal to all workers and young people to join with us in that struggle. Thank you.